We've had a total of 42 cases to date in Missoula. 40 of those cases were identified by testing, and 2 were epi-linked. We've had 41 recoveries and 1 death, with no active cases in isolation currently. The state has had a total of 548 cases, including 7 new cases over the weekend. New cases today were reported in Gallatin and Stillwater counties. In addition to sharing important COVID-related news and guidance this week, we're going to talk about the Incident Command System and introduce you to some of the key players in our countywide COVID-19 response. This has been and continues to be strong, cohesive, and a coordinated community effort. The Incident Command System, or ICS, is a management system that is designed to enable an effective and efficient incident response. In other words, the ICS consists of cooperatively organizing and managing a variety of resources like facilities, equipment, staff, procedures, and communications. Effective accountability is essential, therefore, for things like incident action planning, unity of command, personal responsibility, real-time resource tracking, and span of control. These are critical elements and components of a successful incident management system. You might be familiar with ICS from things like wildland firefighting or disaster response efforts, which, by their very nature, require coordinated and efficient response efforts to minimize risk and maximize the safety of those involved in the response effort and for those affected by the incident. ICS consists of a standard hierarchical structure that allows for a collaborative response by multiple agencies, inside and outside of government, to organize and coordinate response activities without compromising the decision-making authority of the local command. ICS consists of 5 major areas, which are staffed by general command personnel. These areas include the command section, operations, planning, logistics, and administration finance, and safety. We'll tell you about these functional areas as well as introduce you to some key personnel throughout the week. First, we'll start with the role of the incident commander. Cindy Farr, our incident commander, normally serves as Director of Health Promotion at our City-County Health Department. She's been serving in the role of incident commander for more than 11 weeks now. This week, I'm filling in for Cindy as she takes a mandated and much-needed respite, something that is necessary for the sustainability of our ongoing COVID response. The IC is responsible for all aspects of an emergency response. They develop objectives, ensure safety, approve resource requests, and promote an ongoing and unified response effort. Examples of IC duties during the COVID-19 response include things like sharing urgent and important information with staff, community, and safety messages, daily briefings, and media interviews, regularly meeting with community partners to maintain a strong and unified response, ongoing and bidirectional communication with state DPHHS, reviewing and approving all inward-facing and outward-facing communication and messaging, and regular check-in and planning meetings with all general command and staff, ensuring everyone involved in the incident has current information as well as understands our current response efforts and how those things might change in real time. The IC generally goes over and looks at the objectives, looks at our end state, and considers those things into future planning. One of the things that the IC also does during the COVID-19 response is keep an eye on public health and factors that might indicate that we need to shift or pivot our efforts. This is particularly important as Montana and other states gradually reopen. We've been observing and will continue observing things like epidemiological trends, such as case counts, case clusters, and type of disease spread, testing capacity, including supplies, staffing, and resources, contact tracing capacity, and healthcare infrastructure capacity, like how our clinics and our hospitals are doing. Our neighbors across the state and the country are monitoring the same kinds of criteria that we are watching in Missoula County. We've seen that these criteria change. Local authorities respond in different ways that reduce risk and increase safety. Remember that Montana entered Phase 2 on June 1st, per the governor's order. This removed the traveler's quarantine while increasing group size limits. During the past 8 days, we've seen that Bighorn County has recently been hit harder with COVID cases. 24 of the state's 55 active cases are currently in Bighorn County. Current disease data indicates that the coronavirus is moving through community spread in that county. In response to increasing cases and the death of a community member, Bighorn County local authorities made an informed decision implementing additional requirements in that county. Some changes, while more restrictive, are intended to reduce disease transmission while increasing public safety and maintaining healthcare capacity for testing, tracing, and treatment. That's why we've seen Bighorn County provide additional guidance, returning to things like 50% capacity at dine-in establishments and requiring reopening plans be submitted to and approved by the local health officer. Other adjustments include requiring all businesses implement staff temperature and wellness checks and revisions to group size limits and expectations. While reopening and returning to what feels like normal is very exciting, we need to continue moving forward with cautious optimism. We all have a part to play. Please continue practicing social distancing. Wash your hands frequently and often. Clean and sanitize frequently touched surfaces at home, in the office, at your businesses. Keep your social circle small and wear a cloth face covering when it's difficult to maintain 6 feet of space in a given area. Let's continue moving forward together, respecting ourselves and one another by practicing safe behaviors, reducing COVID-related risk, and increasing public safety. Thank you.